Imagine your body temperature dropping to 13.7 degrees Celsius, colder than the food in your refrigerator. Imagine being clinically dead for 3 hours, with no heartbeat, no brain activity, and no signs of life whatsoever. Now imagine waking up completely normal, with no brain damage, no permanent injuries, and no memory of being the coldest human being ever recorded to survive. This is not science fiction or a medical fantasy. This is the incredible true story of Anna Bågenholm, a Swedish radiologist whose impossible survival rewrote every medical textbook on hypothermia and changed emergency medicine forever. Her case gave birth to the revolutionary medical principle: you're not dead until you're warm and dead. Could you survive being colder than a frozen corpse and remain conscious for over an hour while trapped under ice? Stay with us, because what happened to Anna defies every rule of human biology and created medical miracles that are still saving lives today. In the breathtaking landscape of northern Norway, where the Arctic Circle creates some of the most spectacular and dangerous winter conditions on Earth, Dr. Anna Bågenholm had built what many would consider the perfect life. As a 29-year-old radiologist working at the University Hospital of North Norway in Tromsø, she combined a brilliant medical career with her passion for extreme outdoor sports in one of the world's most challenging environments. Anna represented the best of Scandinavian culture: physically fit, intellectually accomplished, and completely at home in the harsh Arctic conditions that would terrify most people. Born and raised in Sweden, she had moved to Norway to pursue her medical specialization, drawn by the combination of excellent healthcare training and access to some of the world's most pristine wilderness areas. Her colleagues at the hospital knew Anna as someone who brought the same precision and dedication to her recreational activities that she applied to reading X-rays and CT scans. She was an expert skier, an accomplished mountaineer, and someone who understood risk management in extreme environments better than most professional guides. Her medical training had given her a deep understanding of hypothermia, frostbite, and cold weather injuries, knowledge that would prove both helpful and terrifyingly inadequate for what was about to happen to her. The culture of northern Norway encouraged this kind of outdoor lifestyle. In a region where winter darkness lasts for months and summer brings the midnight sun, residents learn to embrace extreme weather conditions as a normal part of life. Anna's weekend skiing expeditions with medical colleagues were routine social activities, combining professional networking with the physical and mental challenges that made Arctic living so rewarding. On May 20th, 1999, Anna was looking forward to a relaxing ski tour with two colleagues from the hospital, Dr. Torvald Nesheim and Dr. Marie Falkenberg. They had planned a relatively easy route in the mountains near Narvik, a familiar area where all three had skied many times before. The weather conditions were typical for late spring in northern Norway: cold but stable, with good visibility and manageable wind conditions. The trio represented the kind of outdoor expertise that comes from years of Arctic living. Between them, they had decades of experience in extreme weather conditions, extensive medical training in cold weather injuries, and the kind of practical knowledge that comes from spending countless hours in environments where mistakes can be fatal. They were as prepared as it's possible to be for wilderness skiing in one of the world's most challenging climates. What none of them could have anticipated was that Anna was about to become the subject of the most extraordinary medical case study in the history of hypothermia research. The routine ski trip that began that morning would end with Anna breaking every known record for human survival in extreme cold and fundamentally changing how emergency medicine approaches apparently hopeless cases of severe hypothermia. The irony was profound. A radiologist who spent her professional life interpreting images of the human body was about to experience physical trauma so extreme that it would challenge everything medical science understood about the limits of human survival. The woman who diagnosed other people's medical conditions was about to become the most medically impossible patient in modern history. As Anna adjusted her skis and began the descent that would change her life forever, she had no way of knowing that she was minutes away from an accident that would make her both the coldest human being ever recorded and the longest surviving victim of accidental hypothermia in medical literature. The accident happened so quickly that Anna's companions barely had time to register what they were seeing. One moment, Anna was skiing confidently down a familiar slope, executing turns with the precision that came from years of Arctic skiing experience. The next moment, she hit a patch of unstable snow that gave way beneath her skis, sending her tumbling down a steep embankment toward a frozen stream at the bottom of a ravine. What should have been a manageable fall became a nightmare when Anna crashed headfirst through the ice covering of the stream, her body momentum carrying her deep beneath the frozen surface. The water beneath the ice was just above freezing, approximately 2 degrees Celsius, and moving fast enough to prevent complete freezing despite the Arctic temperatures above ground. The physics of Anna's situation were immediately life-threatening. She had broken through the ice in a narrow channel where the current had carved out a space beneath a thick ice shelf. Her head and shoulders were completely submerged in the flowing water, while her legs and skis remained tangled above the surface, making it impossible for her to pull herself back up through the hole she had created. Dr. Nysheim and Dr. Falkenberg reached the accident site within minutes, but what they found was a scenario that challenged their medical training and their understanding of rescue procedures. Anna's head was completely underwater, but she was conscious and apparently breathing from a small air pocket that had formed between the ice shelf and the water surface. An airspace so small that it should have been insufficient to sustain life. For more than a few minutes, the rescue attempt that followed was both heroic and agonizing. Both doctors immediately recognized the severity of Anna's situation. She was trapped in a position where hypothermia would set in rapidly, but any aggressive rescue attempt could dislodge her from the tiny air pocket that was keeping her alive. They began frantically digging through the ice with their hands and improvised tools, trying to create an opening large enough to extract their colleague. For the first 20 minutes, Anna remained conscious and responsive. She could hear her colleagues working above her and occasionally managed to communicate by tapping against the ice with her hand. Her medical training told her exactly what was happening to her body. Her core temperature was dropping rapidly. Her extremities were beginning to lose sensation, and she was experiencing the early stages of hypothermia that would soon affect her cognitive function. The psychological horror of Anna's situation was almost as challenging as the physical trauma. She was completely helpless, unable to assist in her own rescue, forced to rely entirely on her colleagues' ability to dig through thick ice while her body temperature dropped minute by minute. As a medical professional, she understood better than most people exactly how little time she had before hypothermia would make rescue impossible. After 30 minutes of frantic digging, Anna's responses became less frequent and less coherent. Her body was entering the moderate stages of hypothermia, where confusion and disorientation begin to affect consciousness. The small air pocket that had initially seemed like salvation was becoming a frozen torture chamber, where Anna was slowly losing her ability to think clearly or respond to her rescuer's calls. By the 40-minute mark, Anna had stopped responding entirely. Her colleagues continued their desperate rescue efforts, but they were now working to save someone who showed no signs of consciousness and whose body had been exposed to near-freezing water for nearly an hour. The tiny airspace that had kept her alive was also allowing her core temperature to drop at a rate that should have been fatal. When rescue personnel finally arrived after 50 minutes, they found 2 exhausted doctors still digging frantically through ice to reach their colleague, who had been motionless and unresponsive for more than 20 minutes. The professional rescue team brought equipment that allowed them to break through the ice more effectively, but by the time they reached Anna, she had been trapped underwater for 80 minutes. What they pulled from beneath the ice was a body so cold and lifeless that it appeared to be a corpse. Anna's skin had taken on the blue-gray color of severe hypothermia. Her eyes were fixed and dilated, and she showed no detectable pulse or breathing. Her body temperature had dropped so low that standard thermometers couldn't register it, and her extremities were already showing signs of severe frostbite. What do you think was going through Anna's mind during those first terrifying minutes when she realized she was trapped underwater, with only a tiny air pocket to keep her alive? Let me know in the comments how you think you would react in such an impossible situation. When the rescue helicopter landed at the University Hospital of North Norway in Tromsø, the medical team that met the aircraft was confronted with what appeared to be a frozen corpse. Anna Bågenholm's body temperature was so low that it couldn't be measured with standard medical equipment. The thermometers simply didn't register any reading above their minimum calibration. Dr. Mads Gilbert, the emergency medicine physician who led Anna's treatment, later described his first impression. She looked absolutely dead. Blue-gray skin, fixed pupils, no pulse, no breathing, no response to any stimuli. By every standard medical criterion, we were looking at someone who had been dead for hours. The only reason the medical team didn't immediately declare her dead was the circumstances of her hypothermia. The medical principle that extreme cold can preserve brain function even when all other vital signs have ceased. The decision to attempt resuscitation represented a leap of faith that challenged every protocol in emergency medicine. Standard procedures called for discontinuing resuscitation efforts when a patient's core temperature dropped below 28 degrees Celsius. But Anna's temperature was eventually measured at 13.7 degrees Celsius, nearly 15 degrees below the accepted threshold for survivable hypothermia. What followed was the most extensive and prolonged resuscitation attempt in medical history. Dr. Gilbert assembled a team of more than 100 medical professionals from multiple specialties. Understanding that Anna's case would require unprecedented coordination between cardiac surgeons, anesthesiologists, perfusion specialists, and critical care experts. Thank you so much for staying with us this far. Your engagement means everything to us. And I promise you the most incredible part of this story is still to come. The medical strategy was revolutionary. Instead of attempting to warm Anna's body externally, which could cause dangerous cardiac arrhythmias, the team decided to use a heart-lung bypass machine to gradually warm her blood while maintaining circulation to her vital organs. This technique, called extracorporeal membrane oxygenation, ECMO, had never been used for such extreme hypothermia, and no medical literature suggested it could be successful at such low body temperatures. The technical challenges were enormous. Anna's blood had become so thick from the cold that it barely flowed through the ECMO circuits. Her heart showed no electrical activity whatsoever, not even the chaotic rhythms that sometimes persist in severe hypothermia cases. For all practical purposes, Anna was experiencing what medical professionals call clinical death, the complete cessation of all vital functions. Dr. Gilbert made a decision that would either be remembered as brilliant innovation or reckless disregard for medical protocols. He ordered the team to continue the warming process regardless of how long it took, based on the theoretical possibility that Anna's brain function had been preserved by the extreme cold that had shut down all her other bodily systems. The warming process proceeded at an agonizingly slow pace. Anna's core temperature rose by approximately 1 degree per hour, requiring constant monitoring and adjustment of the ECMO settings to prevent thermal shock that could damage her organs. Her colleagues who had rescued her from the ice maintained a bedside vigil, watching their friend's frozen body being gradually brought back to life by machines. For 3 hours, Anna showed no signs of life beyond the artificial circulation provided by the heart-lung machine. Her brain activity was undetectable, her heart remained completely still, and her body showed no reflexes or responses to stimuli. By every definition used in emergency medicine, she was dead, kept artificially preserved by technology while her body slowly warmed to temperatures where biological function might be possible. The medical team worked in shifts, maintaining the complex balance of medications, temperature control, and mechanical circulation that was Anna's only connection to life. Some team members later admitted to moments of doubt about the wisdom of continuing such an extreme intervention for someone who showed no signs of brain activity or cardiac function. But Dr. Gilbert persisted, driven by the theoretical possibility that the same extreme cold that had stopped Anna's heart might have also preserved her brain tissue in a state where recovery was still possible. It was medical science at its most experimental, a real-time test of hypotheses that had never been proven and techniques that had never been attempted under such extreme conditions. At exactly 3 hours and 15 minutes into the resuscitation attempt, something unprecedented in medical history occurred. Anna Bågenholm's heart, which had shown no electrical activity since her rescue from the ice, suddenly displayed a rhythm on the cardiac monitor. It was weak, irregular, and barely detectable, but it was unmistakably her own heartbeat. The first sign of independent life since her body temperature had been recorded at 13.7 degrees Celsius. Dr. Gilbert and his team watched in amazement as Anna's cardiac rhythm gradually strengthened over the following hours. Her core temperature had reached 28 degrees Celsius, still dangerously low by normal standards, but warm enough for her heart to resume some level of independent function. The ECMO machine that had been maintaining her circulation for hours was now working in partnership with her own cardiovascular system. The medical team faced a new challenge, determining whether Anna's brain had survived the prolonged period of clinical death. 3 hours without oxygen or circulation would normally cause irreversible brain damage, but the extreme hypothermia that had stopped her heart might also have protected her brain tissue from the cellular damage that typically occurs during cardiac arrest. Neurological testing began as soon as Anna's vital signs stabilized enough to allow examination. The results were initially inconclusive. She remained unconscious and unresponsive, but this could have been due to the medications required for her treatment or the continuing effects of severe hypothermia. The real test would come when she was warm enough and stable enough to reduce the sedation that was keeping her comfortable during the rewarming process. As Anna's body temperature slowly approached normal levels, the medical team began to see encouraging signs. Her pupils, which had been fixed and dilated when she arrived at the hospital, began to respond to light. Her reflexes, absent during the hypothermic period, started to return. Most importantly, brain imaging studies showed no evidence of the extensive damage that would normally be expected after such prolonged oxygen deprivation. The moment that changed everything came 12 hours after Anna's arrival at the hospital. As the sedation wore off and her body temperature reached near normal levels, Anna opened her eyes and looked directly at Dr. Gilbert. Her first words, spoken in a weak but clear voice, were a question about where she was and what had happened to her. The medical team's reaction was a mixture of professional amazement and personal emotion. Dr. Gilbert later described it as the most extraordinary moment of his medical career. Watching a patient who had been clinically dead for hours wake up with apparently normal cognitive function was something that challenged every assumption about the limits of human survival. Anna's recovery progressed with remarkable speed. Within 24 hours, she was alert, oriented, and able to carry on normal conversations. Her memory of the accident was limited. She remembered falling through the ice and the initial terror of being trapped underwater, but had no recollection of the 80 minutes she spent beneath the ice or the hours of medical treatment that followed. Neurological testing revealed the most extraordinary aspect of Anna's survival. She had suffered no detectable brain damage despite being clinically dead for over 3 hours. Her cognitive function, memory, and personality were completely unchanged from before the accident. The extreme hypothermia that had nearly killed her had also provided perfect protection for her brain tissue during the period when her heart had stopped beating. The physical recovery was more challenging. Anna's extremities had suffered severe frostbite during her time in the frozen water, and she required multiple surgeries to treat tissue damage in her hands and feet. Some fingers showed signs of permanent nerve damage, and she would need months of rehabilitation to regain full function in her frost-bitten extremities. But these physical challenges were minor compared to the medical miracle of her neurological recovery. Anna had survived the lowest body temperature ever recorded in a human being with accidental hypothermia, had been clinically dead for longer than any previous survivor, and had emerged from the experience with her intelligence and personality completely intact. Anna Bågenholm's impossible survival didn't just save one life. It revolutionized emergency medicine worldwide and established new protocols that have since saved thousands of people from severe hypothermia. Her case became the foundation for what medical professionals now call the Anna Bågenholm principle, the understanding that extreme hypothermia can preserve brain function far longer than previously believed possible. The medical papers published about Anna's case were read and studied by emergency physicians around the world. Her survival at 13.7 degrees Celsius became the new benchmark for hypothermia treatment, proving that patients could survive body temperatures that had previously been considered incompatible with life. The phrase "you're not dead until you're warm and dead" became standard teaching in medical schools and emergency departments globally. Dr. Gilbert and his team's decision to continue resuscitation efforts Despite Anna's apparent death established new guidelines for hypothermia treatment. Medical protocols were rewritten to extend resuscitation efforts for hypothermic patients, with Anna's case serving as proof that recovery was possible, even in seemingly hopeless situations. Emergency departments began investing in ECMO equipment specifically for severe hypothermia cases, using the techniques pioneered during Anna's treatment. The psychological impact of Anna's survival extended far beyond the medical community. Her story became a source of hope for families of hypothermia victims and an inspiration for rescue workers who had previously given up on patients with severe cold exposure. The knowledge that someone could survive such extreme conditions gave new motivation to search and rescue teams working in Arctic conditions. Anna herself returned to work as a radiologist within months of her accident, with no permanent neurological effects from her ordeal. She became something of a celebrity in the medical world, speaking at conferences about her experience and contributing to research on hypothermia treatment. Her perspective as both a medical professional and a survival victim provided unique insights into the treatment protocols that had saved her life. The technical innovations developed during Anna's treatment became standard equipment in major trauma centers. The use of ECMO for severe hypothermia, the gradual rewarming protocols, and the extended resuscitation guidelines all trace their origins to the desperate improvisation that had kept Anna alive during her impossible recovery. But perhaps the most significant impact of Anna's survival was philosophical rather than technical. Her case forced the medical community to reconsider fundamental assumptions about death and survival, challenging the traditional boundaries between life and death in cases of extreme physiological trauma. The woman who had been colder than frozen food and clinically dead for hours had returned to normal life, forcing doctors to expand their understanding of what recovery was possible. Anna's accident also highlighted the importance of immediate and prolonged medical intervention in hypothermia cases. Her survival was only possible because of the complex coordination between rescue workers, emergency physicians, and specialized medical equipment. Her case became a textbook example of how modern medical technology could achieve seemingly impossible results when applied with determination and innovative thinking. The long-term follow-up studies of Anna's recovery continued to amaze medical researchers. Years after her accident, she showed no signs of cognitive decline, neurological damage, or other complications that might have been expected from such severe trauma. Her brain had not only survived the extreme hypothermia, but had emerged completely undamaged from an experience that should have caused massive cellular death. Anna's story became required reading in medical schools, emergency medicine residencies, and wilderness medicine courses. Her case was cited in research papers included in medical textbooks and used as the benchmark for hypothermia survival worldwide. The radiologist who had become a patient had inadvertently become one of the most important case studies in modern emergency medicine. Today, the protocols developed during Anna's treatment continue to save lives around the world. Cold water drowning victims, avalanche survivors, and hypothermia patients benefit from the knowledge gained during those desperate hours when a team of Norwegian doctors refused to give up on their frozen colleague. So what do you think made Anna Bågenholm's impossible survival possible? Was it the protective effect of extreme hypothermia on her brain, the innovative medical treatment she received, or something beyond scientific explanation that kept her alive when she should have died? Could you maintain consciousness for even a few minutes while trapped underwater in near freezing water, knowing that your body temperature was dropping by the minute? This story challenges everything we think we know about the boundaries between life and death. Anna's case proved that the human body can survive conditions that were previously considered absolutely fatal, but only when extreme trauma is combined with immediate, innovative medical intervention and a team of professionals willing to attempt the impossible. Let us know in the comments what aspect of Anna's story amazed you most. Was it her 80-minute survival underwater, her 3 hours of clinical death, or her complete recovery without any brain damage? How do you explain a medical miracle that rewrote the textbooks on human survival? If this incredible story of medical impossibility and scientific breakthrough fascinated you, make sure to subscribe to our channel and hit that notification bell. We bring you the most remarkable true stories of human survival, medical miracles, and the cases that changed science forever. And don't miss our next video, where we'll explore another story that defies medical explanation. The tale of a man who survived being struck by lightning multiple times and lived to become the most electrically charged human in recorded history. Trust us, you won't want to miss it. Until next time, remember that the limits of human survival are far beyond what we imagine, and that sometimes the most impossible cases become the foundation for saving countless future lives.